And welcome back. My name is Michael Yates. This is the Ridgeview Pod, where we try to cover everything hope, healing, and recovery related. There are few things that quite capture that, as well as one of Ridgeview's latest programs, funded through the Department of Mental Health and Substance Abuse Services with the state of Tennessee, and that is our mobile health clinic. And I am delighted to have, now a little over 1 month into implementation, the director of that program, Kim Quartz, with me today.
Hi.
Kim, welcome.
Thank you.
So we're recording this on a Friday, so it'll be posted, I don't know, in a week or so. Today, where is the mobile health clinic?
Today we are in Deer Lodge, which is in Morgan County at the Morgan Scott Project.
So people say mobile. Let's just really explain it from the basics. This literally is a mobile RV, correct?
Correct. It is a custom-built RV that has an exam room for our nurse practitioner, a therapy room, and a reception room. And we move it every day.
Every day this thing is mobile.
Every day.
All right, so we'll go over the locations of where this is parked. What kinds of services can people access out of the mobile health clinic?
Well, we have a nurse practitioner who is duly certified in family medical or family medicine and in psychiatric, so she can do both of those. So we do basic primary, blood pressure, A1C, diabetes, high cholesterol. We also have therapy, and we also have care coordination. So we have somebody who can assist with helping you maybe possibly get benefits or finding referrals for other services that you may need.
And is it for adults only?
No, we see anybody from birth to as old as you want to come in.
I think at one point I heard Leanne, who's the nurse practitioner, say cradle to grave.
Cradle to grave, yes, that is absolutely true.
Since I'm much closer to the grave part, that's good to know. Okay, so what kind of insurance do I need to actually access these services?
You don't need any insurance at all. We are funded through a grant through Project Rural Runway. And if you have insurance, we will bill it. If you don't have it, we will still provide services to you.
Wonderful. Do I need an appointment, or can I just show up?
You can just show up. We do take appointments and walk-ins. Sometimes there might be a little wait if you're just showing up, but you can absolutely just show up.
All right. So it is mobile. It is parked in a different location Monday through Friday.
Correct.
But it's always at the same location on Monday, each day of the week. So let's talk about where those are.
Okay.
So I've got this beautiful rack card that has your lovely face on it right here. So people know who they're looking for, yes. So the hours of operation are typically 9 a.m. to 3 p.m.
Correct.
I guess the exception is when the vehicle is in Central Time Zone.
Right, and then it's 9 to 2:30 p.m.
Central, yes. Okay, so Monday, this vehicle is parked in Scott County. Where?
In Oneida at the Walmart, in the Walmart parking lot.
Okay, so if you happen to live in Scott County or are close to the Walmart in Scott County, look for that vehicle there. We will put a link in the comments below that will take you to the website where you can actually visually see the unit so that you know what you're looking for. Tuesday, this vehicle is in Campbell County.
Yes, we are in Jacksboro in the Walmart parking lot.
All right, so Walmart.
Correct.
Landmarks that a lot of people know. Good. Wednesday, you actually are in Central Time Zone.
Yeah, we go back an hour, and we are in Jamestown at the First Baptist Church, right on Main Street.
That's right. So another central location, just down from the Walmart.
Just down from the Walmart.
But on a very accessible path, and we're Very appreciative of First Baptist Church Jamestown for allowing us to utilize their parking lot. That brings us back into Eastern Time Zone on Thursday. Where are we?
We are in Union County, and we are parked at the Union County Courthouse in their lower parking lot, right next to the main thoroughfare through there.
All right, very good. And now here we are on Friday, back where we began.
Yes.
Deer Lodge at the Morgan Scott Project,
Correct.
So that is actually a very accessible location for people from Cumberland County, Fentress County, Morgan County, Roane County, Scott County.
Absolutely.
So that is brings up I think a good question. What if I am not from any of these counties where this unit is parked? Can I still?
Absolutely.
Come
As long as you're a resident in the state of Tennessee, you can come.
All right, very good. Again, we will get, let's get out the number. Is there a phone number that actually rings right into the unit?
There is. It is 866-599-0466. And it rings directly into our unit.
So tell me, it's been in operation for what, 5 weeks, 6 weeks?
6 weeks, I believe.
When we're recording this?
Mm-hmm.
What's been your impression overall? Has it gone better than you thought? How's the team working together?
The team works together so well. Everybody chips in and does different, that wouldn't be typical duties of their assigned role. Everybody gets along well. They just kind of jump in when it is needed. It's a very small space, so we only have so much room to move. So having a core group that just gets along well makes it a lot easier.
Yeah.
We have seen probably about 25% has been primary care, 75% has been mental health.
Okay.
We had one gentleman who hadn't seen a doctor in 30 years because it just wasn't easy to get to.
Wow.
Or financially couldn't afford it. So that was an eye-opener.
Yeah.
30 years
yeah.
is a long time.
So, I mean, that makes me think of how helpful accessibility is. I mean, what you are doing through this funding and through this vehicle is expanding portals of access for people who otherwise would not go in to see a traditional doctor's office.
Correct.
Well, that's got to really help meet some of the unique needs presented by rural areas that we serve.
We're trying to knock down the barriers, and the barriers typically are transportation and insurance, or lack thereof.
Wonderful, wonderful. Are you far enough into this where you can say, going forward, maybe my biggest concern is what? What might it be? Awnings?
Awnings are definitely a concern. In general, my concern is we are coming across people who need a specialized care, whether it's dentistry, hearing aids, glasses, or a specialist for their physical needs.
So then you have to refer them.
And we're
to
referring.
Yeah.
But the reason they aren't going is because of
Yeah.
not having any insurance. So that has been our biggest obstacle.
Yeah, no, that makes sense. The lack of affordable health care so that people can access specialists when they need it.
Absolutely.
Yeah. Okay, very good. Well, again, only 6 weeks into it.
6 weeks?
Well, 6 months.
Yes.
Come back. We'll do a little refresher update. I would anticipate that since we're not far from flu season, if people want to come to this vehicle to get a flu shot, or is that the kind of thing that would be provided?
Absolutely.
All right. So you come by and get one of those for free. The link to the website of where the vehicle is will be down below, so make sure that you reference that as well. All right. I think people are always interested in getting to know their colleagues and staff a little bit better, maybe not quite so in the professional aspect of their roles and responsibilities. So we like to conclude our podcast with some rapid fire questions that just, help us get to know our guests. So if you'll humor me, these are not mine. I wish I could claim them. I steal these from Greg Bennett, who's a podcaster that I follow in the triathlon world. So you ready?
Ready.
Best decade of music.
80s.
And give me an example of what kind of band or music you would be listening to.
From the 80s, it probably would have been like Def Leppard, Poison.
Yes.
Metallica.
Hair bands.
Absolutely.
Yeah. All right. I got you. Are you a cook?
No, I pretend to be one though.
Okay, if you were to prepare a meal, what
Yes.
meal would you prepare?
I make homemade lasagna.
Okay.
Okay.
Homemade lasagna.
Yeah.
You're going to invite 3 guests to that meal that you've prepared. Can't be family members.
No family, okay?
Living or dead, who would those 3 guests be?
Oh my goodness. I don't know. That's very difficult for me to think of who I would want, living or dead.
Now, Kim, it's not a test. It's just
I know.
something to have a little fun with.
I know. Taylor Swift has been huge in life right now, so she will be one.
Of course.
She would be one.
Everyone
I think
wants
she would be
Taylor
a
Swift.
fun
Yes.
person to hang out with. Now I'll go take it back to the 80s music and maybe Bret Michaels.
Okay.
Find
all
out
right.
what it was really
Okay.
like back in.
Yep.
And
The Poison heyday. Yes.
absolutely. And then let's go with Tom Cruise.
Oh, wow.
I just want to see if he's as really.
I was expecting another musician.
Yeah,
so-
no. I want to see if he's as entertaining as he is on interviews
Yes.
in person.
I see you're selecting your words wisely.
Yes.
Okay, very good. Sounds like an interesting dinner
It would be.
conversation. Yes, yeah. Okay, so last book you read.
The last book I read. I'll be 100% honest. I could not tell you the title of it. I have Kindle Unlimited, and I just kind of read through books.
Yeah.
I could go with an author that I really
Okay.
like. I like Danielle Steele.
Okay.
I do.
Can't say that
You've read
I've
any of
read
hers?
any of her great literary works, but no, that's good. That's good. Favorite movie?
Pretty Woman.
Oh, okay. All
I'm
right.
going to take it back a little bit.
Yeah. All about Richard Gere and Julia Roberts.
Absolutely.
Well, see, this wasn't all that bad, was
No.
it? You know, little fun, little levity. And you too can expect those kinds of questions when you come visit the Mobile Health Clinic at a location near you. Thank you for coming in.
Thank you.
Thank you for tuning in. We do hope you will familiarize yourself with the location of the clinic because someone you know may benefit from accessing that portal of integrated primary and behavioral health care. Thanks for tuning in. We'll see you next week.